First, I need to apologize to Anna for relocating her from Tanzania to Uganda. Anna is a resident of Tanzania and represents the Tanzania Association of Social Workers. And as I said, personally, I'm really looking forward to this session because it's an area we haven't heard much about yet, and I'm hoping we can hear your experiences and your thoughts about going forward with this important area. So, Anna, over to you.
Thank you so much. My name is Anna Swai. I'm from Tanzania Social Association. I'm a social worker. For us, we thought we need to put that IPV with family domestic violence because this is really important for us. Why it is important for us? In Tanzania, almost 90% of the people we help, women we help, they normally engage family when seeking for help. And when we talk about family, this is from maybe a partner, children, and other members of the family. For me, I think it's really important, first of all, to start with what is social work. And I'm going to adopt a definition from International Federation of Social Workers. What they say to us, they believe the social work professions promote social change, problem solving in human relationship, and empowerment and liberation of people to enhance well-being. Utilizing theories of human behavior and social systems, social work intervenes at the point where people interact with their environments. And principles of human rights and social justice are fundamental to social work. So what do? We interact with different people in the society, and we intervene when people need support, whether it's psychological support or any other kind of support. But whatever we do, the principle of human rights and social justice is really fundamental of what we do as social workers. And I'm going to just summarize the snapshot of IPV and abuse in Tanzania. And I believe yesterday's session and today's session have covered all the numbers, but I'm going to put my emphasis on the last point on this slide, which is the limitation of reporting systems and recording of IPV and or other forms of domestic violence. In Tanzania, we have a huge problem of reporting systems when it comes to the IPV and forms of abuse. What we're trying to say here is, yes, we have a problem, a huge problem, but we don't have a reporting systems. And since we don't have a reporting system in place, it is very hard for us as social workers to address IPV appropriately when the need and support is needed. So we're looking forward to have a reporting system and records which will inform our practice. And this is really important for us. It is really important for us to discuss challenges in addressing IPV in Tanzania. We have a lot of challenges, but we just try to number the challenges which we think these are really important challenges for us to be addressed. We have lack of protocol or policies. We don't have any protocol in hand or in place to safeguard adults when it comes to adult protections. Mr. Batema was talking about protection orders. So basically, when we have a woman who has been abused and we want to protect this woman from not getting the abuse from the partner or spouse, we cannot put even a protection order for the man not to go back to the house and abuse this woman. So it's hard for us as social workers to help when we know we are powerless, we cannot do anything, and at the same time we understand we need to protect women from abuse. And there's limitation of legal protections. We're talking about legal protections for victims of domestic abuse. Yes, we have laws in place, but we're still developing these laws. And when it comes to child protection laws, we have a law, Child Act, which has been implemented in 2009. Yes, we have a law in place. It is very new, most of us, we don't know how to articulate it and to address the protection of children, because we need to interpret this law according to our needs as social workers in Tanzania. And there is also lack of understanding of women issues. This is really complex because we believe when there is IPV, most women will have a lot of complication issues. And this is from maybe mental illness, HIV, substance abuse, the list goes on. But there's limited of understanding of these issues regarding to women. There's lack of resources in addressing IPV. We don't have resources. A typical job for a social worker in Tanzania, you will have sometimes to pay your own money to reach a woman somewhere in the village or in even in a local area. So since we don't have much resources in the place, we are struggling very much indeed. There is also a challenge in developing the workforce. What happens here, we have social workers in Tanzania, but the challenge is how do we develop this workforce to provide the quality of services? That's a main challenge for us, because we are aiming to develop quality of services, but we need to have a workforce which is skilled to intervene when there is need of interventions. This is just a summary of how the social workers can intervene and when addressing IPV and domestic violence. So we believe what we do case management. This means we're linking clients and agencies in order for our clients to access services and care. This can be maybe medical or psychological. So we work with APOs, NGOs, and CEOs. This is really difficult for us because we don't have in place a referral systems which allows us to link with these agencies appropriately. So we need to do a lot of work in making sure that we are linking our clients with appropriate services and agencies. There's also a presence of social workers in various settings. This is healthcare, hospital, hospice, and et cetera, but there's very few social workers in hospitals. So we are hoping to do a lot of advocacy work around this area so the government can hire social workers and place them in hospital settings and clinics. We also need to have counseling and therapy schools. And at present in Tanzania, especially in public schools, we don't have the presence of social workers, even though we know there's a lot of violence at school and around school, which has really impacted in learning, but still we are not able to place social workers in schools. There is also, through leadership engagement, where we need to work with human services management, we need to engage in policy development, but in Tanzania, when we talk about policy developments, we are not able yet as social workers to engage in policy development levels. And this is really important for us because we feel and we believe the people who are making these policies, somehow they cannot put in our clients' shoes. So how can they come up with policies which will have really impact to the service we provide? We also need to organize community and advocacies. We believe organizing community and engaging advocates will help us a lot. We have learned about SASA model and other models from yesterday, and we believe this will be really helpful for us. And we need to teach in social science researches. This is the area which we need to put more emphasis in order for us to have research which will inform our practices. There is also government offices and ministries which are currently hiring social workers at district levels, which is something to look forward, and we thank for this. Now we're talking, how can we support social workers? how can we support and build social workers' practice in Tanzania? We believe, and we are very sure, we need to infuse evidence-based practice. But not only that, we need to look at our cultural needs in providing training, education, and in building capacity of the professions. At presently, we are working on this, but we have a long way to go. We can also support social work practice in Tanzania by providing continuing education for social workers. This will help us to improve in assessment, intervention, and mobilizing resources in providing assistance and help for IPVs. We also feel that building collaborations with other providers is really important for us, because, for instance, for Tanzania Social Worker Associations, 2 years ago we were in ICU. I should say that, even though the association is old, almost 31 years old, but for the last 27 years, we were very almost dead. And we just came into place again 2 years ago, since this is from 2010, by the help of FEFA, of course, through American International Health Alliance. So we believe collaborations with different agencies is really important for associations to grow. So in doing that, we trust building capacity through social education is really important for us. Before engaging ourselves into the building the capacity of the profession in Tanzania, we only had one school of social work, which was only providing diploma in social work. This was until 2 years ago. So when we engage ourselves as Professional Social Workers Association in TASO, we managed to mobilize 12 schools in Tanzania, helping them to develop curricula and also making sure that our social work education in Tanzania is meeting the global standards. So we have potential 12 schools in Tanzania, which we have managed to establish 2 master's programs and 1 BSW program. We are working so hard on this area, and we believe we will achieve as long as we keep working hard. So what we're trying to say is, when we are doing this work of developing this curriculum, we are trying to emphasize this curriculum should meet the indigenous needs of the people who want to assist. I might say this program is supported by American International Health Alliance through the University of Chicago. And by doing this, we believe and we hope having a collaboration like this will help us to make sure that even though everything we do in terms of pre-service education, it will have IPV material and training within. We also believe that we need to prepare the next generation of social worker students in Tanzania. Since we have a huge gap in terms of education and quality of education, so what we're doing now, we're making sure that when we're developing these curriculums and harmonizing these curriculums, we're making sure that we're having a curriculum which have IPV within. So we are telling these institutions to make sure that they are putting some specializations on it. We shouldn't just teach social workers education. We should also emphasize that we need to have students who are qualified, who will go out there and work. Not only work in an area which they are specializing and be competent and provide quality of care. So we believe we need to create opportunity for our students to understand that IPV as a public health concern, and we all need to work together. We also, believe that we need to develop programs and field for our students, which will give them a room to grow and learn in the field and take into the classroom and back again. So what we're saying is we promote evidence practice social work. We need students to be able to articulate what they have learned and take it to practice. Right, I have 5 minutes. I'll be very fast. Okay, so for us as a social professional association, we believe we are growing because we have collaborating with other social workers around the world, i.e. the NSWs. This is Association of Social Workers in the States. We are working with this association in helping us to develop training material for social workers in order for us to provide continued education for our social workers in the field. This is the Association of Social Workers website. The information is there. What we believe in intervention at all levels of social workers practice, we believe that we need to work with ministries to support legal and policy change. We need to partner with community leaders to support behavior change, which a lot of people have mentioned before. We need to fund and expand professional social worker education to build skilled and to provide quality of care. We need to encourage cross-border learning and share knowledge skills. So the way forward for us as an association, we believe we need to support, engage in culturally relevant research into IPV and other forms of family violence and work towards the implementation of the findings. We need to engage social workers in research and implementation with focus on addressing social norms that can be helped to reduce conflict resolutions, build health relationships, etc. We need to use NASO, TASO model of collaboration to make sure that we are providing quality of care. We lack this model of collaboration, TASO and NASO, because they have gone far in terms of research and practice evidence and social workers trainings. So we are using their materials, but we are making sure that they meet our local standards and provide trainings for social workers in Tanzania. So we are hoping to have maybe Uganda Association of Social Workers, Kenya Association of Social Workers, Tanzania Association of Social Workers, to collaborate and learn and grow together and when providing care to IPV clients. And I must thank the Uganda National Academy of Science. Thank you very much for this opportunity. I thank the Institute of Medicine and the Forum for Global Violence Prevention and my colleagues in America, NSW USA and TASO Tanzania. I thank you very much for giving me this opportunity to share what we do in Tanzania as social workers and also to learn a lot of knowledge which we really appreciate. Thank you so much indeed. I must stop here.
Well, thank you very much, Anna. That gave us some great insights into the social work challenges you're facing, but also the opportunities for contributing towards reductions and addressing the problems faced with IPV in Tanzania and in the region. And first, I'd like to ask the audience to offer their thanks to all 4 presenters.